I'm Ernest Sink. I am the co-director for the Center for Hip Preservation. I am part of the Hip Preservation Service and the Pediatric Orthopedic Service at the Hospital for Special Surgery. So the patients I typically see are ages birth through 40s. A lot of the pediatric age patients I see are for hip dysplasia or hip pain. The skeletally mature or adolescent or young adult patients I see usually have hip pain and dysfunction that affects their activities of daily living. So walking or running, they complain of pain that really affects them. A lot of them have been referred by other physicians for hip dysplasia. So I do a periacetabular osteotomy, which is probably the surgery I do the most. So I think transitional care from infant through adulthood is very important just to understand what's the hip pathology. So it's amazing to watch, to be able to follow patients from birth through young adulthood. I think it gives you a better idea of the spectrum of the disease you treat. Patient education is critical because they have to understand what they're signing up for. A lot of what we do is not me saying, you have to do this. It's me educating them on the risks of surgery, the benefits of surgery, the alternatives of not doing surgery, so they can make an informed decision if they want to put in the effort to go through it. What we want to do is to give a completely patient-centered experience when they're here. Having surgery or having pain is a really stressful thing. So we want to make sure when they're here, from the first phone call to their visit, that we spend a lot of time with them, they're fully educated, that the whole experience of the surgery, the pre and post-op, is a good experience.